Hi everyone. Today, Latinas Contra Cancer will be talking about lung cancer. To give more background on us, Latinas Contra Cancer is a nonprofit organization in San Jose established in 2003 to provide cancer education, patient navigation, and psychosocial support to Latino families facing cancer. Our goal is to provide greater access to high-quality medical care to our community. Before we can discuss cancer, we must first understand the biology of our bodies. Every single part of our body is made up of cells. They are the smallest and most basic unit of all living things. The average adult has about 37.2 trillion cells. These cells are packaged together to create bigger things like tissue, which go on to form our organs, such as our heart and our lungs. All of our organs then go on to form our bodies. It's similar to the clothes that we wear. You see a shirt or you see some pants, but when you look really closely, you notice that it's actually made up of a bunch of little strings packed closely together. Together, these strings make up the shirt, or in this case, our cells make up our bodies. In order for us to keep growing or repairing ourselves, such as when we get a cut, our cells divide to replenish the cells that were lost. They replicate everything that's inside of them and divide in half multiple times to make more and more cells. In a single day, 2 trillion cells divide in our bodies. A small mistake in the division of a cell can make the cell completely malfunction. And if that bad cell stays in our bodies, it is going to keep dividing, and those cells will also be bad. Usually our bodies, with the help of our immune system, will kill a bad cell as soon as possible to prevent it from dividing and making more bad cells. But nothing in the world is perfect, and sometimes our bodies don't recognize when a cell is not working properly. When cells don't work the way that they are supposed to, because of an error, this can cause a disease. In the case of the disease that we call cancer, the problem with the cell is that it begins to divide uncontrollably. This machinery that allows our cells to divide and to keep our body functioning is very complicated and delicate. However, one easy way to think about it is as if we had 2 stoplights for each cell, one from our mom and one from our dad. In reality, we don't actually have stoplights in our cells. But I will talk about stoplights because it is an easier way to visualize it. Basically, there are these stoplights in our cells that tell the cell when it's okay to divide, or if it's not okay to divide because we are not ready. In other words, they give a green light or a red light to signal when cells should be dividing and when they shouldn't. These stoplights represent certain genes in our DNA. If one of our stoplights shuts down, it's okay, we can still function because the other stoplight is still working and keeping everything under control. But when both of our stoplights in our cells shut down, our cells can't control their division. They don't know when it's okay to divide. Normally, when our cells are full of errors and mutations, our stoplights will then turn red and say, stop, we can't divide. But when we don't have our stoplights, the cells will just divide no matter how bad they are. This is what cancer is. In cancer, our cells will divide and nothing will stop them because those cells lost their stoplights. The uncontrollable division of our cells results in clumps of these bad cells, which are called tumors. Once the cell stops being able to control its division, more and more mistakes that ruin the function of this cell will happen. And these problems will be passed on to the daughter cells until the cells in this tumor are completely unrecognizable as the cells they used to be. For example, if this was breast cancer, the breast cells will no longer look like breast cells, and they would only work to cause chaos and to turn healthy cells into cancerous cells, which in this image can be seen as the orange cells. Now, not all tumors will lead to cancer. Cancer meaning that the bad cells will be so bad that they will cause our body to stop working properly. Some tumors are benign. These can often be removed, and in most cases, they do not come back. In benign tumors, the bad cells stay within the same area. On the other hand, malignant tumors will cause problems in our bodies. This is because malignant tumors will have cells that will travel to other parts in our bodies. These cells are so unrecognizable that they just cause chaos as they travel through our blood and our lymph nodes to other parts of our bodies, causing cells there to become cancers. Once the cancer travels to multiple parts of our body, it is a lot harder to remove. And of course, this can happen anywhere in our body because our whole body is made up of cells, which is why there are so many different types of cancer. For example, pancreatic cancer means the cells in our pancreas started dividing uncontrollably. And lung cancer means that the cells in our lungs started dividing uncontrollably, and so on. Some cancers can be genetic and some usually aren't. When we say it's genetic, it doesn't mean that your parents passed you the cancer or that you were born with it. It means that you're more likely to get it because one of your parents was also at risk of getting cancer. The reason cancer can be genetic is because you were born without one of your stoplights. This could be because one of your parents lost their stoplight during their life, or they were already born without it, so they couldn't pass it down to you. When you're born without one of your stoplights, you're at a disadvantage already because only one bad thing has to happen to you for you to lose your other stoplight. People who are born with both stoplights are at a lower risk of cancer because it is very unlikely for them to lose both of their stoplights during their lives. It is more likely for someone to just lose one of them. So how can we lose our stoplights? We can lose them through random chance or through environmental factors. This means being exposed in high amounts to radiation, to UV light, which comes from the sun, to toxic chemicals. These toxic chemicals can be in our food, in the form of pesticides, in waste, in alcohol, or in processed foods, in drugs that we are given to treat other diseases, in smoke that comes from factories, and in smoke from cigarettes and other drugs. That doesn't mean that if you eat an apple that is inorganic and that was treated with pesticides, or even if you got an X-ray, that you will certainly get cancer. Our bodies are different and they react to things in different ways. But being exposed to these and many other environmental factors for multiple times for a long time can cause our stoplights to die. And why is it that it's important to bring awareness to cancer in Latino communities? It is because 1 in 5 Latinos in the US die from cancer. It causes more deaths in Latino community than heart disease. Latinos are diagnosed at a much later stages of cancer when it is harder to remove it than other ethnic groups, causing Latinos to die from cancer at a higher rate. This is because Latino communities are much more likely to be exposed to all the things I said kill our stoplights, such as unhealthy air and poor diet, etc. Also, Latina communities in the US are more likely to be low income and therefore not being able to afford to live in areas that have the good quality air, healthy foods, or even being able to afford healthcare or to have access to the education that allows them to know about the risk factors for cancer and to know what preventative measures can be taken. So it's important for us as Latinos to understand that these are the disadvantages our community has and that this is the state of our community in this country so that we can take measures to take care of ourselves and our families in the best way that we are able to. Now we will move on to talking specifically about lung cancer and about some cancer myths. Smoke from drugs is the most prevalent cause of lung cancer because it is a way that cancer-causing chemicals directly access our lungs. In addition to directly smoking a drug, being exposed to secondhand smoke, whether that be from someone smoking near you or from the smoke of a factory, can also cause cancer for the same reasons. 1 in 5 Latino teens smoke, and 1 in 10 Latino high school students smoke. So the prevalence of smoking in Latino communities is very present. Additionally, in Santa Clara County, about 1 in 4 of Latino teens reported smoking some form of tobacco in 2019 to 2020, with vapes being the most common tobacco product. Additionally, 87% of deaths related to lung cancer are due to smoking. Lung cancer is the type of cancer that causes the most deaths in the US. It is also the leading cancer that causes the most deaths in Latino men and the second leading cancer for women, right after breast cancer. So I said that smoking is the most common cause of lung cancer, but what does it mean to smoke? When I say smoking, you're most likely to think about tobacco cigarettes that you can buy in stores. And yes, tobacco cigarettes and their smoke can cause cancer, but so can the smoke of any other drug. The smoke from electronic cigarettes is also as bad. There are several types of electronic cigarettes. Juuls and vapes are very common among young people. Cigarettes and other forms of smoking marijuana can also cause lung cancer. And any type of drug that can be inhaled or smoked can cause cancer as well, although the most studied is tobacco and nicotine smoke. And again, just because you smoke any of these once in your life or for a year, that doesn't mean that you will definitely get cancer. But the more you smoke, the more your risk of lung cancer increases. The risk of being diagnosed with lung cancer increases with the number of cigarettes a person smokes each day. And if you smoke for many years, for decades of your life, it is highly likely that you will develop lung cancer. And you also have to remember that if quitting smoking is very difficult, it is not because we are weak or unable to stop. In fact, the CDC recommends 8 to 11 attempts to quit smoking. It is normal for quitting smoking to be difficult. It's a biological reaction. It's the way everybody's body works, and it is not something that is under our control. It is not the fault of the person who has trouble quitting. Smoking not only causes lung cancer, but it can also cause hypertension, other lung diseases, heart attacks, and other types of cancer, such as bladder, kidney, and esophageal, and many more. Symptoms for lung cancer do not appear until its late stages. Some of the common symptoms that you can look for are coughing that doesn't disappear or worsen, coughing with blood, hoarseness, loss of appetite, inexplicable weight loss, difficulty breathing, fatigue, feeling weak, and constant lung infections. The American Cancer Society recommends that people have an LDCT, a CT scan that is used to diagnose lung cancer if you are 55 to 75 years old, or if you have a 30-pack year history of smoking. This is a number that represents the number of packs you smoke per day multiplied by the years that you smoked. For example, if you smoke 2 packs a day for 15 years, that would be 30 pack years. So the test should be taken at that time. Also, this recommendation applies if you currently smoke or if you stopped smoking in the last 15 years. Finally, it is important to talk to your doctor and tell them if you smoke so that they can take good care of you. The most important way that lung cancer can be prevented is to stop smoking or to not smoke at all. After that, it is important to prevent being exposed to secondhand smoke, be it smoke from a drug or industrial smoke. Also, eating healthy, eating fruits and vegetables that have antioxidants is important since they help the body to protect itself against chemicals that can cause cancer. Also, exercising and reducing stress can also help you quit smoking and prevent cancer. Headaches, digestive problems, and anxiety are symptoms of stress. Reducing stress can help you quit smoking, prevent cancer, and simply improve your life overall. To reduce stress, you can try to take a positive attitude, to read, walk, meditate, and if you need emotional help, you should seek it as well. On the subject of meditation, there are several ways to start meditating. For example, there are videos that you can watch on the internet, or there are also phone apps. One app being Headspace. It teaches you how to meditate, and I'm sure that there are several other types of apps that are available for this. We want to clarify that cancer is not a punishment from God. It can happen to anyone, good or bad. And cancer is not contagious and can be treated. In some cases, cancer is hereditary, but we've already talked about how that doesn't mean you were born with cancer. It simply means that you were born with a higher chance of developing cancer. But lung cancer in particular is caused more by the decisions made in life and is less common to be hereditary. Also remember that it's not bad to talk about cancer. It is important that we talk about cancer so that this information can reach many more people and the rates of early detection of cancer can be increased. Not talking about cancer or being afraid to talk about it with your friends, with your families, and your healthcare providers can be deadly. That is why it is important to detect it as soon as possible. Finally, we want to draw attention to support groups. Support groups can improve the quality of life for cancer patients, survivors, and their families. Support groups create an environment of support and understanding. It can help detect and reduce emotional trauma by reducing feelings of isolation and loneliness, as it allows you to hear the stories of other people who are going through very similar situations and having similar feelings. They can give hope and self-esteem since they allow you to hear the stories of how other people overcame their situation. Our organization, Latinas Contra Cancer, currently provides a support group service. So if you're interested in knowing more about our support groups, call our office. Thank you all for tuning in to this small presentation on lung cancer and the methods that you can take to reduce the risk of developing it. If you have any questions or feedback, please feel free to contact us. Here is our website for more information. Thank you very much.